today, I'm going to present something that I feel has become just recently the hottest health topic around. And you'll find that I ask a lot of whys. The key to this presentation is what causes diabetes? Why do people get diabetes? What could be serious about an earache? When I walked out of the room, I immediately told them to get a blood sugar because I was convinced that this 6-year-old girl with an earache was not so simple. And the reason was this 6-year-old girl had a blood sugar of already over 200, which one reading will give you diabetes. If you're over 200 on any reading, you automatically have diabetes until you prove that it's not. And the reason why is this 6-year-old girl was 180 pounds already. These are real patients. Let me tell you, it is coming. An epidemic is here. And we have totally eliminated the juvenile or adult onset because people are getting type 2 diabetes when they're 6. Young children. There's also other ways to get diabetes. You can have head trauma and get what we call diabetes insipidus. You can get trauma to your pancreas and get diabetes that way. You can get bronze diabetes. There's a million types of ways that you can get diabetes. There's dozens of types of diabetes. I'm not going to focus in on all of them. That's not useful for the layperson. I'm going to focus in on what is probably the most common cause of diabetes, common type of diabetes, and that's type 2. However, I don't want to skip over to that before I touch on a type of diabetes that actually up to 5% of women will get during their lifetime. Do you know what that is? Yes, gestational diabetes. Now, I want you to understand this very clearly because it's going to help you later on in the presentation. When a woman has gestational diabetes, what's the big deal? What's the big deal? Have you ever heard of a woman trying to deliver a 15-pound baby? Try 18 pounds. Close to 20 pounds? No big deal? I'd say that's a big deal. This baby's shoulder will get stuck. They'll have to do emergency C-sections. This is a huge deal. And what do they use to treat gestational diabetes? Do you know? Anyone know? Insulin. They give the woman insulin during her pregnancy. Now, insulin is what type of hormone? Yeah, what does the baby end up being? Big, right? It's a growth hormone, right? And I think we all intrinsically know that. And that's a problem for baby because mother may be resistant to insulin, but baby is not. Do you understand that? So baby gets very, very big. So insulin is a growth hormone. Remember that. That's going to be very important for the second part of our lecture. Let's look at epidemiology. Type 2 diabetes is the most common type of diabetes in our country. Up to 95% of diabetics are type 2, which means that they don't have a lack of insulin. They actually have an abundance of insulin, but the cell is resistant to the effects of insulin. So keep that in mind. Many people who are diabetics are undiagnosed. And through every year in the United States, it gets more and more and more. The CDC just came out with some statistics that are so alarming that you're not even going to believe it when I tell you. 1 out of every 3 children born after the year 2000 will die of diabetes. 1 out of every 3, directly from the CDC's website. 1 out of every 2 minority children, black or Hispanics, will die of diabetes. Half. Big deal? Absolutely. Do you realize that that's right upon us? A child that's born in 2000 is like 12 right now. It's coming. It's an epidemic of monumental proportions. But don't worry, there's a cure. talk about diagnosis. What are some of the symptoms that people have when they have diabetes? Sure, we have a lot of them coming out. I hear thirst, frequent urination. What I want to focus in on first is sometimes you have no symptoms until your doctor tells you, you know what, your kidneys are shutting down. That may be the first symptom you have, and you've got to go on dialysis now. You may have the first symptom be permanent damage to your body. But you're right, thirst, frequent urination, anything else? Fatigue. I heard someone say it affects every organ system of your body. If you just go through all the organ systems, I'll say yes to all of them. One of the first things that people do, in fact, I talk to diabetics, and they say, you know, I can always tell my sugar is out of whack because of this. Yes, my vision gets blurry. And do you know why that is? Because sugar is what we call an oncotic agent. It draws water, right? When your sugar goes up, the sugar goes up everywhere. The sugar goes up in the lens of your eye. Did you know that? And it draws water, and now you can no longer accommodate because your lens works by flexing and relaxing so that you can focus on things close up or far away. But when it's like swollen, you can't focus anymore. So that's one of the first signs is visual signs. But how else might it affect your vision? Yes. People may complain of blurry vision or difficulty seeing because of diabetic retinopathy. That's right. Any other signs or symptoms? Sure, some people will lose weight. That's generally type 1 diabetics because type 2 diabetics are generally overweight. Yeah, we'll get to that later. Anything else? Infection, absolutely. Infection, wounds that won't heal, right? Diabetics' immune system is very, very suppressed. Even a very minor infection can become life-threatening. In fact, that's a decision tree that happens all the time in the ER. Someone has a little cellulitis or skin infection. All they have to say is, I'm a diabetic, and they get admitted. It's very, very rare to send a diabetic home with those types of infections. And there's other things too. There's all the ones that you mentioned. We'll get into a little bit more. And lab tests, what might you see? High blood sugar, right? That's what we all know about. But there's other things too. Kidney damage, you can see proteinuria. You can see microalbumin in their urine. You can see basically the kidneys damaged and it's letting protein spill in the urine. Normally our body recovers the protein. But in a diabetic kidney, you can see they're losing the function steadily. There's many other things. Most of us are used to diagnosis of diabetes with a blood sugar, and the standard number is 126. Have you heard that? A fasting blood sugar of greater than 126. That's what we're looking for diabetes. But did you know that's changing now? On my blood tests, anything over 100 is considered abnormal now. It's totally different now. And the reason why the lab has to flag it as abnormal is because what they're finding is that they didn't flag abnormals until they were beyond 126, but they've totally changed that now. Now, every lab test that comes back is going to have a high by it that's 100 or greater. And the reason why is they're finding those people have pre-diabetes. In fact, this is so frightening, but they find that if your fasting blood sugar is somewhere between 90 and 100 even, you carry the gene. One or both of your parents has transmitted the gene to you. It is very frightening. They're having to lower the threshold farther and further for diabetes. What's the number one cause of death for diabetics? Anyone know? Yes, heart attack. Heart attack is up to 10 times more likely in a diabetic than without it. It's very, very serious. And the scary part about it is when a diabetic is having a heart attack, what do they feel? Do they feel substernal chest pain radiating down their left arm to their jaw with nausea, sweating, shortness of breath? I mean, that's the typical, right? All of those studies are from the Framingham research, which were done on white males. But when you deal with diabetics, all bets are off. I've had diabetics come in and say, you know what, I feel nauseated. I look at the EKG, acute MI. I've had people say, I just feel weak. Troponin, way off the chart, acute MI. It is scary. But their only symptom may be nothing. They have many silent MIs. And that is very concerning. Number one cause of death in a diabetic is going to be MI or heart attack. But it's also a cause of complications, not just death. Diabetes is the number one cause of, what do you think? Blindness, well, technically it's probably macular degeneration, but it's coming close. Diabetic retinopathy. Diabetes causes the blood vessels in the back of your eye to just kind of go out of proportion. They multiply and multiply, and then the problem is that the retina is like the projector screen for your vision. Does that make sense? And if I scribble a bunch of things on the screen and, all kinds of spaghetti string and all this other garbage is on there, you can't really see very clearly. And that's how it works with diabetic retinopathy. So what else? It's the number one cause of something else. Kidney failure, that's right. Now, it's actually close to high blood pressure, but I believe that diabetes is going to win out as far as the number one cause of dialysis and kidney failure. It's also the number one cause of something else. The heart disease, we talked about that. Yes. People don't mention this because they don't think it's a big problem. Diabetes is the number one cause of erectile dysfunction in the United States. Is that a big deal? Absolutely. It is a serious quality of life issue. There's a reason why Viagra and Cialis are multi-billion-dollar drugs. That's important to people. And it's the number one cause is diabetes. Now consider this for a moment. Is it possible that you are a transient diabetic, meaning a temporary diabetic? We talked about one of those cases, right? When a woman gets what? Right? Gestational diabetes. She has diabetes during what period of time? Her pregnancy. And then after that, you hope. You hope that it's gone. But gestational diabetes is a very clear risk factor for developing type 2 diabetes afterwards. It's a warning. It's like, have you ever heard of a TIA? Do you know what a TIA is? A mini stroke. Someone will have blindness for 30 minutes, or their right hand won't work for a little while, or they can't speak, or their face is slurred. That is a warning that the big stroke is coming. Gestational diabetes is the same. It's a warning that you may develop permanent diabetes. But consider this. What if you are perfect in controlling your diabetes? You eat the American Diabetic Association diet, you take all your insulin, you take all your medications, you are very good about your eating habits, and you control your diabetes for your entire life. So that means you live to what? 79, right? Wrong. With perfect control of diabetes, you lose an entire decade from your life on average. I don't want you to control your diabetes. I want to cure it so that you don't lose those 10 years. So let's go to the cause, right? Because we can't get to the cure unless we know the cause. This is a classic study that was done decades ago by James Anderson at the University of Kentucky. He took healthy young volunteers and he decided to give them a pound of white sugar a day because he felt that that would cause what? Diabetes. Because everyone thinks that the cause of diabetes is sugar. But when he gave these male volunteers a pound of sugar a day, he went several weeks. I mean, I can't imagine them choking down a pound of sucrose every day. But you know what? It's pretty easy. You know why? You just crack open a soda and you get 12 teaspoons right there. Banana split, 25 teaspoons. It's easy for it to slide down when it's in food, right? Delicious, but deadly. So they ate a pound of sucrose a day, and after several weeks, several months, no diabetes. Then he placed them on what we call the good life diet, the SAD diet, the standard American diet. The standard American diet is actually about 40-some% fat. So Dr. Anderson decided to crank it up because he didn't want to wait a whole long time. So he gave them a 65% fat diet. In 2 weeks, 100% of them had clinical diabetes. When I'm saying 100%, I mean their urine, I mean their blood sugars, I mean their hemoglobin A1C, I mean their glucose tolerance test, I mean all the tests that we use and the parameters that we use for diabetes, they all showed clinical signs in 2 weeks. So is the cause of diabetes sugar? Obviously, sugar's not good for you, right? Because we talked about how sugar can raise the fats, right? We talked about the triglycerides earlier this morning. But what's the real culprit? Fat. And it's not just fat in the diet. It's fat on you. It's fat in your liver. It's fat in your muscles. That is the key. And the reason why that happens is, imagine, if you will, a cell, right? A cell needs a regular supply of glucose to survive, and it gets that from your bloodstream. What happens when the cell is full of fat? If you can imagine, the body uses insulin to unlock the cell and let the glucose in. Now the problem is, as the cell gets full and full and more full with fat, it creates a need for more insulin to kind of force the sugar into the cells. That's why people with type 2 diabetes, they actually have higher levels of insulin. Did you know that? They have higher levels of insulin, not lower levels of insulin. They are not lacking insulin. They are lacking the space in their cells to take it in. They become what's called insulin resistant. And the answer that we have come up with is just pound them with more insulin. Right? Yeah. But of course, we'll find out that that's not the ultimate answer, right? The most common treatment, what would you say the most common treatment for diabetes is? Insulin, right? Now watch this. This is a real scenario. Real scenario. Someone comes to your office and they're diabetic and you put them on insulin. And you tell them, listen, you got to lose weight, right? You got to start exercising. I'm going to have to put you on insulin. When they come back to you in a couple months, you put them on the scale and you know what's happened? They've gained 8 pounds. Hey, wait a minute. Didn't I tell you, you got to change your diet, you got to start exercising, and I got to give you more insulin? And they come back 2 months later and they've gained 10 pounds. And I was like, wow, are you just lazy? What's wrong with you? I got to increase your insulin again. What kind of hormone is insulin? Oh, no. Oh, no. Do you understand why insulin doesn't cure diabetes? Do you understand why people aren't cured of their diabetes? We as physicians are giving them one of the most powerful growth hormones known to man. It is hard to lose weight when you're shooting up growth hormone. Can you imagine? Doctor, I'm trying. No, more insulin. Now, I'm not saying that insulin is evil, right? There's a time when you need it. I see people in the ER, they come in diabetic comas. I've seen people with a glucose of 2,000, and they are totally out of it. I've given people liters and liters and liters of fluid. I've put them on insulin drips, infusions. But do you see that the cure for diabetes is not insulin? Do you understand that? In fact, if you rely on that, it's actually worsening the problem over time. There is a place for insulin in the acute phase, but the long-term phase should focus on the cause and thereby focus on the cure. right? You will need the insulin, but the answer is not more insulin and more insulin. The answer is get rid of the fat, right? That's the key. So consider this in the light of the effect of insulin. What did we say was the number one cause of death? Do you know what effect insulin has on the coronary arteries? It is one of the most rapidly potentiating and accelerating hormones for atherosclerosis. It increases the accumulation of plaque in your arteries. Number one cause of death, right? I'm not saying it's not going to be necessary, but it's a dangerous way to treat it, right? It's okay in the acute phase, but it shouldn't be your focus. Consider this. How many people come to you and say, you know what, my doctor increased my insulin and my diabetes is cured? Has anyone ever said that to you? Well, wait a minute, why not? Because they don't have a lack of insulin. That's not the main underlying cause, right? That's the treatment and the management. But do you want to manage your diabetes or do you want to cure your diabetes? We all want the cure, right? Consider this. How about natural insulin? Well, is there any difference between the insulin you take and the insulin your body creates? Is there a difference? Interesting. Did you know I can make any one of you right now in 1 hour synthesize 10 units of regular insulin? You know how I can do it? Have you take a brisk walk for an hour. It has the same effect on your blood sugar as 10 units of regular. But it gets at the cause. Because as you begin to exercise, what are those cells going to do with the fat that's plugging them all up? It's going to burn it. And that will make it more sensitive now to insulin, right? That's the key, right? And if you're not flooding the cells with fat from the diet and you're burning, right? You're burning the fat. That's better than any amount of insulin I can give you. Because its effect is not only going to lower the blood sugar, but it's going to get rid of the cause that's making the blood sugar high. That is the cure for diabetes. If you normalize someone's weight through diet and exercise, 95% of the diabetes on this planet will evaporate. For free, right? I don't have any kickbacks from Whole Foods or Trader Joe's or whatever. I don't get any checks from the Carrot Association or anything like that. But you can do that, right? It's what Dr. Feit and myself have been talking about in several of our lectures, right? Consider this. What are the most common drugs used for diabetes outside of insulin? Do you know what they are? Well, metformin is one, but have you heard of glipizide, glyburide? They're called sulfonylureas. You don't need to remember that. That's a long term about the chemical structure of these compounds. Glipizide and glyburide are very important because they work by causing the body to release more insulin from the pancreas. Now, they can be dangerous for that reason because if you take an overdose of glyburide or glipizide, what do you think can happen to your blood sugar? It can drop. Now, here's the problem. The half-life of some of these drugs is 19 hours. There was actually a street drug called Valium. Have you heard that? A lot of people sell it. And let me tell you, I have half a dozen people trying to play me every day in the ER for Valium, OxyContin, Dilaudid, Percocet, fentanyl, you name it. But there was a very sneaky drug dealer, and he realized that he could get glyburide for cheaper than Valium, but it made people feel similar. So he was selling people glyburide, and we had all these people dying of hypoglycemia. They felt the rush because their blood sugar dropped, and many died. Now, the problem is that these drugs are cleared by the kidneys, But what happens to a diabetic's kidneys? Uh-oh. So sometimes these drugs, if they get to be a little bit too high, they're not cleared either. That's one of the easiest admits I have in the ER. Someone comes in, low blood sugar, the medics get at them, give them an amp of D50, resuscitate them, and they say, I feel fine, I want to go home. And you let them go home, they will die. Because the half-life is 19 hours, they go to sleep, and they never wake up. Now, if the person's on insulin, that's different. That's a short-acting drug. But these are long-acting drugs, so it's a very easy admit. The doctors upstairs never fight with me. I said, I got a patient with low blood sugar, and they're like, yeah, so what? You gave him D50. I'm like, oh, but he's on glyburide. Okay. They give me no more flack after that. That's the end of the conversation with the inpatient doctor because they know these drugs have such long half-lives. But it's very interesting. Do you know what a black box warning is? Every one of these sulfonylureas carries a black box warning. And do you know what the black box warning says? Increases the risk of MI. Wait a minute. What was the number one cause of death for diabetics? Oh, no. MI. Am I saying that these are unnecessary? No, sometimes they are necessary. But you don't want to stay on them. Does that make sense? The insulin may be necessary, but you don't want to stay on it. You don't want to let it do damage to your coronaries. I'm going to go and show you now that there was a very old clinical trial. In fact, it was the oldest clinical trial known to man. Do you know where it was? It was on the plains of Dura in the kingdom of Babylon. Daniel chapter 1, take a look. Daniel chapter 1, as our study design begins, we have the subjects. The control subjects are who? Not them. They're the experimental. Unfortunately, the control subjects are the vast majority of the Israelites, right? Who bowed the knee, right? And surrendered their faith. Do you think Daniel, Shadrach, Meshach, and Abednego were the only Jewish people taken captive? Where there's only like 4 people left in Jerusalem? I mean, right? Obviously there was more. But how many of them compromised? All but 4. I pray that we'll have more than 4 from our audience that doesn't compromise. Amen? So the control group is the other kids of Israel. Now, were these like the lower end of the class? Were these the dummies that were taken captive from Israel? No, you kill all those people off, right? These were the sons and daughters of who? The princes, the royalty, right? They were no dum-dums to begin with. These were the creme de la creme de la creme of the captives. And they were given the privilege, right, of eating the best food available, right? Or was it the best? Now consider this for a moment. What was in front of Daniel? Anything he wanted, right? We had the meats, we had the wines, but consider this. Daniel looks there. Could he not have said, well, just give me the clean meats? Could he not? Could he not have said that? Hey, you know what? I'm vegetarian. Lacto-ovo. Could he not? Did he? No. Right? Daniel was a scientist, I believe, even at that tender age. He knew that to create results, you have to create what kind of difference? A wide difference between the control and the experimental. You know what? I'll be vegetarian and drink a little soda and stuff like that, right? Diet. Okay, diet. I'm going diet. What did he drink? Water. What did he eat? Plant foods. Right? And just like Dr. Fight was saying, this is not going to work, this is going to be the worst, this is going to be the best. How would Daniel have known? How did he know? Who told him this? That this was actually what we were built for? Where did he read it? Genesis what? 1:29 and Genesis 3:18, right? The original diet, plant foods minus what? Vegetables. And then after sin, what was added? Vegetables, right? And what did he drink? Water. Not soda, not Gatorade, right? Water. Could he have done that? Sure, he could have. He could have said, I'll take the beef and the chicken. Oh, salmon's really good for you, Could he not? But he didn't. I think that's very significant. He did not. Because people say this was an issue of the unclean and the food sacrificed to idols. Well, he could have eaten the clean meat. He could have been vegetarian, right? But he did not. He said, give me pulse, Melzar. Prove thy servants how long? 10 days. So that's the trial, right? 10 days, and let them give us pulse or plant-based diet to eat and water to drink. And Daniel was so confident. You realize he's putting his neck on the line. And Melzar said that. He said, listen, if you look worse, I may get my head chopped off. Right? But he was so confident. He says, listen, whatever you see, you deal with your servants that way. Is that faith? That's faith. That's believing that God will do what he says. Right? And after 10 days, who looked better? Daniel, Shadrach, Meshach, and Abednego. And so, since they looked so good, what did they decide to put them on from then on? David spent his 3 years at the University of Babylon drinking water and on a vegan diet. So don't tell me if you're a student you don't have time to eat healthy. Daniel spent his entire career of university eating God's, well, Tim, between classes I'm just rushing, What, Daniel could do it at University of Babylon. How about you? Right? Does it make a difference even though you're young and healthy? Sure, absolutely. But there was a difference. After 3 years, we didn't just see a physical change. What did we see? And in all matters of wisdom and understanding, Nebuchadnezzar found them how many times? 10 times better. Not just in the other subjects, not in the compared to the control subjects, even the wise men and the magicians, right? They had a lot of years ahead of Daniel, Shadrach, Meshach, and Abednego, but Daniel and his friends still outgunned them because they had access to the knowledge of the tree of life. Praise God. Now, has this diet ever been used for diabetes? As a matter of fact, just recently. Do you guys know who Neil Barnard is? Barnard is the chairman of the Physicians Committee on Responsible Medicine. He is not a Christian as far as I know, or an Adventist yet. But he actually put a vegan diet head-to-head with the ADA diet. Did you know that? This is considered the gold standard, right? This is what all diabetics should be eating. He put them head-to-head, and what I find is very significant, well, it was a vegan, plant-based diet versus the ADA. It was 22 weeks long, 50 patients in each arm. Now, interestingly enough, I think the most significant portion of this is the food was not provided to them. So what does that mean they had to learn to do? They had to cook it. They had to prepare it. And so it was not provided, and so they implemented this program in their home. Do you realize that? In the real world. A lot of people say, well, yeah, I'm doing great because I'm here at Weimar for 19 days, and everyone's like making the food for me, and I got this guy who's walking with me for 10 miles a day. That's great, but when I come home, hey, wait a minute, no one's making me all the food anymore. It's a little different, isn't it? That's why I think this study is very, very important, because it shows you, can people do this in the real world? I mean, trust me, these were not Adventists that were recruited either. These are like regular people, okay? They had to learn to cook this way. Now, as far as the success of the program, in the vegan group, almost half of them cut their medications. In the ADA group, only about a quarter. In the vegan group, they lost 14 pounds in 22 weeks. Impressive. That's very, very impressive. That's like half a pound a week. Praise the Lord. And in the ADA group, they lost just a little over 6 pounds, so twice as much weight. Now, here is a very significant number. It may not be big to you, but it's huge to me. The LDL cholesterol in the vegan group dropped 21%. Now, why do you think that is significant to me? What's the number one cause of death in diabetics? MI. What do you think is one of the biggest risk factors for MI? LDL cholesterol. In fact, if you look at points, even percent, if you drop your LDL cholesterol by just 1%, that's dropping your risk by like 3%. So this group dropped its risk of MI by over 60%. That is huge, huge. The ADA, they dropped it by 11%. And in the vegan group, they actually had better glucose or glycemic control. And I think probably one of the most significant things about this is that the vegan group was easier to follow as far as putting in practice because they did not have to count calories, carbs, or portion sizes. And the ADA diet, you have to count all those. They just told the vegan group, here's how to cook vegan, eat. Well, how much can I eat? Whatever. What's a portion size? Who cares? Do I have a calorie limit? No. That's it. Very simple. And they had better results. What I tell people is you can't argue with the data. It's obviously a better plan, right? It's almost double. Is the other one bad? No. But why would you take good when you can have best? Right? Praise God. He gives us the best. He gives us the ideal. Now I'm going to make it very practical for you. Some people say, well, I'm so active. I'm running after my kids all the time. And, doctor, I don't eat anything. And I said, well, why do you weigh like 500 pounds? Obviously, you're eating something. You're not like absorbing it by osmosis, right? You don't have photosynthesis to create this stuff. I know that. There's no chlorophyll here. So what I'm going to share with you is a big frustration that my patients say. They're like, listen, I exercise all the time and I don't eat anything. My husband, he can eat like 4 times as many. He doesn't gain a pound. It's not fair, right? I'm going to give you secrets to losing weight that have nothing to do with diet or exercise. How about that? Here they come. The power of an apple. Before every meal, this is very practical, I want you to eat an apple. Well, Riesenberger, you're adding calories to my diet. I'm going to gain weight. True or not? What do you think? Would you gain weight or lose weight if you did this? You know how it works? When you eat that apple, an apple is only about 100 calories. And it is full of fiber. It has got no cholesterol. It has got no sodium. It is a whole plant food. And that fiber is going to fill you up so that when you go to eat, you're not going to eat like the bad stuff. Does that make sense? My sister tried this diet. And in 5 months, she lost 20 pounds just doing the apple diet. That's it. And there's nothing magical about an apple. It's just any high fiber food that you eat before you eat the other stuff. The next one, I'm going to take you to the land of Japan again. But this time, we're not going to go to Okinawa. We're going to go to the mainland. And typically, people in Japan are big or small? Small. Genetically, they're typically small. Except for one section of society. They are the sumo wrestlers. How is it possible that these guys who genetically should be small end up like 500 pounds. How do they do it? I'm going to give you the secret to the sumo. And so what you want to do is when I tell you the secret of the sumo, what do you want to do to lose weight? Reverse it, right? When the sumo gets up in the morning, the first thing he does is he doesn't eat breakfast. He skips every breakfast. Sound familiar? He eats a big lunch, and then after lunch, I watched some of you guys at the 2:30 meeting. Don't think I wasn't watching you. You were going the way of the sumo. They eat and then siesta. Oh wait, that's Hispanic, sorry. Anyway, they take a nap. But all cultures have that, unfortunately, the postprandial coma. That's what we call it. And what do you think your body's going to do when you eat and then sleep? You might as well slather it on right now. And when do you think they eat their biggest meal? Not just night, late at night. And the people in Japan will sometimes go to McDonald's, not to eat, but to watch the sumo eat. As he puts away heroic amounts of fat and calories. A big platter full of Big Macs and hamburgers. And then he goes to sleep. What do you think happens to all those calories? Right? Think about your metabolic curve. When your metabolic curve is at baseline, right, the lowest possible, and you've got a flood of calories and fat coming into the bloodstream, what's the only option for your body? Storage. So when should you eat the biggest meal? Breakfast. People say, oh, I don't want to start eating breakfast, then I'm going to gain weight. Did you know it's proven that you burn 25% more calories by eating breakfast? You actually will lose weight if you eat breakfast. Because if you skip breakfast, your metabolism goes down. When you eat that meal, it fires up the fuels. You're going to use those calories for energy, for glycogen synthesis, for protein synthesis. That's when you want the big bolus of calories, is when you've got the big metabolic curve coming up. So later in the day, right, you should eat what? Less. And if you're going to skip a meal, skip dinner, right? People say, well, I'm a night shift worker, right? I'm a night shift worker. I can't do that. Well, it's the same concept. When you're done with your shift and you come home and you go to sleep, don't eat right before you go to bed. And we talked about this a little bit before. If you eat a large meal before going to bed, you can cut your melatonin production in half for that night. Not just a problem for your weight, but a problem actually for your longevity. So if you don't want to look like the sumo, don't eat like the sumo. But we all do, right? Here in America. We skip breakfast, right? We eat our biggest meal when? Late at night. And what are you going to do at night? Just watch TV, right? Or hopefully you're watching Amazing Discoveries, right? So if you want to do the opposite of the sumo, reverse their lifestyle. Here's an old wives' tale that Dr. Art Ulene, U-L-E-N-E, decided to examine. Remember your mom? She'd always say, now make sure to chew your food, what? 30 times. So he looked at that. He looked at people, and they were allowed to serve as their own controls. And this is how that works. He basically just filmed them eating and allowed them to eat whatever they want and counted all the calories. And then the second arm of the experiment was the crossover, where he said there's now only 2 rules. 1, you have to wait 30 seconds between each bite. 2, you have to use small utensils. Like instead of a soup spoon, you have to use a teaspoon. Instead of a dinner fork, you had to use a dessert fork, right? And he told them both arms of the experiment, eat as much as you want, be satisfied. Did you know they ate half as many calories? And do you know why that works? Because there's an area in your hypothalamus that controls satiety or satisfaction. And I'll give you a hint. that area is sculpted by many things. It is sculpted by practice, by habit. Have you ever known someone, they're like, I just have to eat something sweet or I'm not full, right? That's the hypothalamus talking to them. Or you have someone who say, I have to eat something crunchy, right? Or I just haven't eaten. Or I knew someone who had to eat a little piece of meat, actually. Like a little salty something. Or they weren't full. They hadn't eaten, But what happens is they've found that if you chew, it directly stimulates that area of satiety. Remember, you don't chew here in the stomach, right? You're not getting any more stimulus. If you're wolfing stuff down, you're probably going to eat too much, right? But if you take your time, chew your food, not only will you enjoy it more, but you're actually going to be as satisfied and eat less, right? Great. Here's the last one. Who knows who Dr. Atkins was? Atkins diet. Yes. You know where Dr. Atkins, now obviously it's a lot more complex than this, but I'm going to share with you what gave him his idea for the Atkins diet. And you can use principles from his research to craft a diet that will create weight loss, even though you don't change the amount of calories you eat. You're just going to change the types of calories that you eat. Some people say, well, a calorie is a calorie is a calorie. Is that true? No. We were just talking about, at lunch, we were talking about, well, protein is protein is protein. That's not true either. Fat is fat is fat. That's not true either. So calorie is calorie is calorie is not true either. People just say it's a mathematical equation. No, it's not. It's not that simple. Dr. Atkins came up with his idea for the diet by looking at a concept, and you can look this up. It's called the thermic effect of food. Look it up. Thermic effect of food. And what the thermic effect of food is you take a surplus of calories, right? That's how you store, right? You have more coming in than going out. But what is the surplus? That matters. Because the body can't just take food and just put it here. Like an apple doesn't just grow right here, right? It has to take the molecular structure of that food and change it around and turn it into fat, right? Particularly animal fat, fat, right? So let's say you eat 100 extra calories one day of fat. What does that look like? What's 100 extra calories of fat? Do you realize it's just a pat of butter? A little, when you go to scrape out the margin of butter and go, Instead of scraping the toast off, you kind of lather it on. It's easy to get 100 extra calories. Like not even a tablespoon of oil. That's like 140 calories. Pretty easy. So an extra 100 calories of fat is going to be converted to what? Fat. How hard do you think it is to convert fat to fat? And not too hard, right? If you take that 100 calories, your body has to spend 3 of them in conversion. So if you eat 100 extra calories of fat, 97 calories, onto the spare tire. So what other types of calories besides fat do we have? There's fat and protein and carbohydrate. Let's go to carbohydrate. What does an extra 100 calories of carbohydrate look like? What does it look like? Slice of bread, yeah. So you eat an extra slice of bread. It's a little harder to do that, right? Hey, would you like another piece of toast? Maybe half of one, You want butter on it? Yeah, sure. Pretty easy. But it's a little harder to get 100 extra calories of carbs, right? So 100 extra calories of carbs is a slice of bread. And if you eat that 100 extra calories of carbs, what do you think your body has to do to it? It has to rip it apart and create a long carbon chain, right, out of that carbohydrate molecule. So to convert 100 calories of carbohydrate to fat, do you think it's more or less costly than the first equation? More. It actually costs you 21 calories. Do you know that? So what are you left with? 79, right? Now let's go to protein. 100 calories of protein, what does it look like? Half a cup of beans, right? We'll stick to the vegan ones, right? How many calories do you think it costs to convert 100 calories of protein to fat? More or less? Even more, because remember, you have to run the urea cycle now, because it's excess protein. That's costly. It's 31 calories. So what are you left with? 69. So where do you think Dr. Atkins was going to tell people to go? Protein. But not just that. There's a process called beta oxidation that burns fats. And in order for your body to burn fats, it has to burn it in the fire of carbohydrates. Did you know that? If you have no carbohydrates, you can't run beta oxidation. Did you know that it will directly burn fats and will create acids called ketones? Right? That's why people on the Atkins diet are like dipping their urine all the time. They are creating temporary diabetes. Does it work? Absolutely. If you put yourself into ketosis, you're going to burn fat like there's no tomorrow. But it will cost you. You are putting your body under tremendous strain. Dr. Atkins is actually dead now. Not from the Atkins diet, though. But I can tell you, these diets get people to do them because they work at a high price. But what can we learn from Dr. Atkins' research? Don't go on the no-carb diet. Of the 3 categories of food, if you're going to eat from those categories, which category should you eat more from? Carbohydrates, right? And proteins. What should you eat less of? Fats, right? It's not rocket science. If you're going to want to lose weight and you want to lose fat, then don't eat fat. It's not hard, right? Although not all fats are equal. The plant fats, I'll give you a little tidbit on this, is they did an experiment where they looked at rhesus monkeys. And the reason why they like rhesus monkeys is this, from a genetic standpoint, they're very similar to the human code, right? And they divided them into 3 arms: control, dairy fat, and avocado fat. And what they found is that they accidentally gave too much fat to the avocado group, so it was a little bit skewed, so they expected that they would have, bigger waistlines. Did you know they had smaller waistlines? Because monounsaturated fats discourage abdominal deposition. Dairy fats, and this is the big risk factor, right? It's not fat in other places. In fact, women, they want fat in other places, right? It's the fat here that creates the risk. Did you know that? It's the truncal obesity. It's the fat up here and in the waist that increases your risk for heart attack, diabetes, stroke, things like that. So the answer, if you don't want to be fat, then don't eat fat, right? But you can eat your calories from carbohydrates, from proteins. And the nice thing is if you eat a whole plant food diet, you're going to get the right amount of fats. The good Lord is so compassionate. Do you know that there is a nut that has the highest fat content of any nut? Does anyone know what it is? Macadamia. Did you know that there's a nut that has not 1 but 2 shells? Do you know what nut that is? Macadamia. Isn't that amazing? The Lord is so good, isn't he? He knows that it's good for you, but not too much, right? Let me tell you, if I had to shell every nut, I'd probably eat just like this much a day. Right? You'd eat the right amount. So there's your secrets, but of course, ultimately, much more than diet, what do you think the key is for reversing diabetes? Exercise. And I think we as Seventh-day Adventists, our Achilles heel is exercise. People are very strict about their diets, but they are board-certified couch potatoes. They just don't do any physical activity. It's sad. You know, less than 10% of Americans have a regular exercise program. And you know what's amazing? Is that they found that the 3 days a week, you can improve on that. Did you know? They looked at the literature from 3 days a week up to 4 days a week. Which do you think was better? 4 days a week. They went from 4 days a week to 5 days a week. Which one was better? They went from 5 days a week to 6 days a week. Which was better? They went from 6 to 7. No, 6. Oh. Maybe you think we should labor 6 days and, what's the rest of it? The Lord's so good, isn't he? He gives us the best plan, not just for diabetes, but for living forever. That is my prayer for you.